So an ambitious leader in response to HIV and tuberculosis, an innovator and a real missionary. So please meet Executive Director of Alliance for Public Health, Andriy Klepikov. Good morning. You will not see a presentation. We will create it all together. We will look at where we are now and what we can do with it. So in our region, the epidemic of HIV is still growing. 1,700,000 people in the region of Eastern Europe and Central Asia live with HIV. As for tuberculosis, there are 259,000 of TB cases registered every year. New infections in our region are growing at a quick pace. It's 23% of growth every year. We usually associate HIV and AIDS with African countries, but in Africa we see a different trend. So there is a decreasing number of new infections every year. We see it, and for us it is a signal that something is wrong and that we need to do something about it. In our region, the key populations are drivers of the epidemic. So new HIV cases in over 40% of cases are attributed to injecting drug use, about 30%. This year and last year were associated with partners of key populations. About 20% of new HIV cases are associated with the group of men who have sex with men.
And there are other groups too, who are out of the main statistics, but they are extremely vulnerable, such as transgender people. And we see here a man, and it's not by chance, because it is men who are 2 times more populous than HIV-positive women in our region, while it is believed that women are generally more vulnerable to the infection. 90-90-90 targets. We've been speaking about those, and the situation in the regions is much worse than in Kyiv. The first 90 is actually 72% HIV-positive people who know about their status. But how many of HIV-positive people receive treatment? Just 38%. That's less than a half. That's about 1/3 instead of 100. And that's a huge problem for our region. For even smaller number of people, this treatment is effective. That is, reduces the viral load until undetectable. The situation with tuberculosis is even more dramatic. As I've said, 260,000 new cases of tuberculosis are registered every year. Out of them, 30% are cases of MDR TB. We see that the situation in the region is worse than elsewhere in the world with MDR TB. And now multi-drug resistant tuberculosis is the biggest problem in the context. On the right you see the column that describes our region. Look at it. Near it you see figures explaining the situation around the world. And out of every new case in the world, only 3% are MDR-TB. In Eastern Europe and Central Asia, that's 18%, 6 times higher. And if we speak about the repeatedly treated tuberculosis, that's 54%. I was at the high-level meeting of the UN where we had different public officials from different regions, including ours, and when this information sounded, when it was voiced and when they understood that a public official, very high rank, he really was amazed. He turned and said, "What the fuck is that?" And that's truly so. It's difficult to find the words. You don't need to reinterpret it additionally. Why? Because the situation is not just worse than everywhere in the world. It's 6 times worse in our region. But don't start nodding like everything is so bad. It's not so bad. We are here not to pity ourselves or complain about the situation. We are here to find solutions. And there can be at least 2 solutions. First, don't forget about yourself. The problem of HIV and tuberculosis is not someone else's problem, it's our problem, yours and mine. You cannot use some other people to change it. If you want to change something, ask yourself, what I am going to do about it today or tomorrow. Don't forget asking this question every day. Not what they are going to do about it, what I am going to do about it. That's probably the most important point, because without this movement, without this ownership, this is going to be someone else's problem for you. And the second point, we don't have the time, we don't have the resources to do some shit. We are here to use as much effective solution as possible. The solutions that have proven to be the best, those that produce the best results. And in fact, that's up to the cities. Because in the cities, there are about 1/3 of all HIV positive people, like in Sofia or Tbilisi. In the cities like Kyiv, we have more HIV positive people than in whole countries such as Georgia. And that is why the city itself needs to resolve the tasks that are similar to the national or even exceeding those. Sometimes when we beat the epidemic in the city, we can then control it in the whole of the country. If we look at Ukraine, for instance, if we are able to control the epidemic in 5 cities, Kyiv, Odessa, Dnipro, Kryvyi Rih and Mariupol, we're going to be able to stop the epidemic in the country. So our focus on the cities is the key in resolving the problem. Now talking about methodology, you don't need to reinvent the wheel. We have the working principles allowing reaching fast track in our response to HIV and tuberculosis. We've been working in the cities for years, and we know that there is a model that can produce a real result. First is the focus on key populations, key groups. Second is focus on the services that bring the real results. And the third is policies, working with decision makers and policy makers. And finally, that's exchange of experience, sharing the best practices. That's what's been effective in the cities. And let me tell you, the work with the key groups, for example, in the city of Sumy, they now have a free drug use room with our support. In the city of Odessa, drugstores are involved in harm reduction programs. You can get free of charge syringes there. In the city of Almaty, they now have a safe room, safe environment for key populations such as LGBT or other groups. So in every city actually where we work, there is a couple of lawyers helping people with legal counseling. Working with youth is a whole new set of issues. People of 15 years or 16, you cannot come up to them with newspapers or leaflets. There is a method that we have piloted in Kyiv, drugstore. It's a project where we don't even identify ourselves as the alliance. No one's interested in that. There is a different brand, something that draws the attraction of the young people. Okay, maybe some grand old lady would be scared of it, but those old ladies are not our target audience, and the young people, they want to contact this boss to get inside, to get counseling, to learn what they need to learn, and such things must work and be scaled up. If we want to move somewhere, if we want to reach the risk groups and who are very vulnerable, those are young people experimenting with sex and drugs. Drugstore is also a Telegram channel. It's a resource that's available online. Everyone can download an app, free to ask application, and get advice, get counseling at any time of the day. Talking about the cascade, I would say that the cases that go missing, they go undetected, is another big problem, and the case of Almaty shows how rapid testing allowed detecting 1,500 new cases actually. So they just made this test mobile. It's mobile with the means of a social worker, of an outreach worker. You don't have to go to polyclinic. A social worker, an NGO person can go to the people who truly need testing. Moreover, you don't need to bring some logs or notebooks. You got a Cyrex cloud system that allows you to see in real time who has received services and what was the scope of the services and where it happened. So that's also shifting the traditional work, the conventional approach, to the new technology, to the new way of doing things. In Kyiv, we went even further than that. We've started using the artificial intelligence to look for the most risky cases of HIV infections. That's a unique development. We sometimes see it when we go to Amazon, for instance, and when we buy something, we will get immediately the advice like, oh, people who buy this book usually buy that book too. That's actually the way we can use the experience not just of the social worker, but also expect that the AI would calculate and inform us about where there is the most infections, and those are the recent infections, 3-4 months up to 6 months. They are the most contagious, providing the highest risk of infection new people. As this way we reach to the most dangerous vectors of the disease. So returning to the Almaty case, Yes, there we have a situation when a case manager brings the person from the diagnosis to the following steps, further diagnosis and linking up to care. They even have this special term, people who are lost to support lost to care. We don't need lost people. We need people who get treatment. And in Almaty, we see 1,500 of people who were detected. They all have been linked to care. In Odessa, that's tuberculosis, and I've spoken about that, and Odessa is not an exception. It's a standard case. When we started our work, that was to have the effectiveness of treatment at 50%. And after our discussion with the mayor, a decision was made on how to drastically improve the effectiveness. There were several ways for that. First was to provide primary care level treatment. You don't need to go to some tuberculosis dispensary somewhere far away. You are not contagious if you have started treatment already. So by reducing this level, by dropping down to the primary care level, we were able to improve the effectiveness of the treatment. Second is motivation. It is popular to say that money follows the patient. I don't care where they follow. The most important thing is that they bring the result. And the incentive used to be just 13 hryvnias for every contact with the patient. And for the final curing, that's 50 cents. But it is these resources that allowed us to improve the effectiveness to reach more than 70%, and in our project where we implemented that to 90%. That's a fantastic result. In Balti, Moldova, we see the example of integrated services. You don't need to travel around the city to get one service, and another service, and the third service. If you need tuberculosis, SMT, counseling, ART services, now you can get it all in one place, at one site. It's not the patient who needs to travel around the cities following doctors. The services follow the patient, provided based on the needs of the patient.
Needs of the person, needs of the individual. So business, they have client-oriented approach, and in healthcare, we also need to use it. It is also a technology that we need to implement, and in Balti, it showed a result of a cure rate at 90%. As for the policies and politicians, for us, signing political declarations, Paris Declaration, for example, is the commitment that the mayors undertake. Yes, this is an issue, and by signing this declaration, I commit to resolving this issue. The same goes for the Zero TB declaration. So zero TB cases is the aim. Tuberculosis is a curable disease. We see that in 2017, when we started, there were only several cities who joined this initiative. And every year, there are more and more cities joining. Now, at this point, there are 14 cities which signed Paris Declaration and 4 cities which signed Zero TB declaration. But today, a little bit later, this number will go up. So, as for the resources, of course, they should be available. And we see that by signing declarations, cities they approve municipal programs for HIV, tuberculosis, sometimes also hepatitis. Balti, which before that never had any allocations from the municipal budget, they approved a city program and started funding. Odessa allocated $2.5 million for 3 years for the municipal program on HIV/TB. That's a great result. And our cities, they are not very poor, especially considering the decentralization process. And the municipal resources are to be utilized. As for the knowledge exchange, that's what allowed to someone to get inspired, for someone to see how it works. It's like after the visit to Bern, when the mayors were able to see how programs for injecting drug users work. They do not have HIV transmission among injecting drug users. There are no criminal activities there. Why not to use this experience here? Also, here we can talk about the cities conference, International City Health Conference. For the first time, we brought this international conference to our region. Last year, it was organized in Odessa. There were over 30 countries represented there. And we can talk about such programs as Harm Reduction Academy. They change the mentality and approach of people, in particular in their attitudes to key populations. Results are important for us, and the results are decrease the incidence of HIV, TB cases, and the main thing is saving lives. We see that those programs not just function, but they bring results. And those results are lives and fates of people living in the cities. So cities are a perspective area of activities, and we need to invest more there. Invest money, invest resources, invest time and the drive. We plan to extend the list of cities, including at least 25 more cities, and we are open. All those things that we work on, they are not for me, they are for you. And all people who are interested to get any support from us on how to work in the cities or elsewhere, we are ready to provide such support. We are open. And as for the cities, it is important to remember that curbing the epidemic in the countries is possible through working at the municipal level. Cities can change the situation in our countries, not just some abstract cities, but mayors, leaders of the cities, and all of us, citizens. For us, it is our way forward. And I would like to end my speech with the slogan of our new project, In Your Power. It is in your power, it is in our power. Thank you.